The following is a presentation of the Nashville Health Care Council and Nashville Public Television.
Today we are honored to have Newt Gingrich, former Speaker of the U.S. House of Representatives and the founder of the Center of Health Transformation here. Many of you know him from his previous political career and his work to improve Medicare, investing in medical research, and reforming medication access. Today, you'll get to know him in his role at the Center of Health Transformation, a collaboration of public and private sector leaders dedicated to the creation of a 21st century intelligent health system. And the focus of that health system, obviously, to save lives and to save money. One of Speaker Gingrich's and the Center's core tactics is uniting stakeholders across the spectrum, from businesses to nonprofits to government agencies, with a shared vision in order to transform a community or the country. So with no further ado, can you please join me in welcoming our keynote speaker, Newt Gingrich.
What I want to do today is deliver a very simple but profound value proposition. And it really comes from a perspective that the great challenge we have in the United States today is to figure out how to make very significant changes in a way that they become mutually reinforcing. This is such a large country and has such a huge economy and has such complex government. Remember that there are 513,000 elected officials in the United States. And the general tendency is to try to reduce our problems to something which Washington can fix. And it doesn't work that way. Because the fact is that the real fundamental changes occur at a remarkably local level. People's lives are lived locally, and people make decisions on a daily basis. And this is such an enormously complex country that 90 or 95% of the decisions people made are actually outside of government. They may be within some broad framework like, you try not to go more than 10 miles an hour over the speed limit. But they're not, in fact, shaped on a daily basis by government leaders or government as a system. They're shaped by individuals, deciding, do I want my kids to go to soccer or to baseball or to football or to piano or to nothing? Do I want to get a job or not get a job? Where do I want to go on vacation? What kind of clothing do I want to buy? There are an amazing range of things people do that are not the product of bureaucratic behavior. And what I want to make to you is a very simple proposition about reality. And I think that Nashville is, to a peculiar degree, the right place to do this. And we talked about this at considerable length at the Center for Health Transformation. And Ben was part of the key in convincing us to come here, because in many ways, Nashville is to health innovation what Silicon Valley is to IT innovation. If you look at the number of people in this city who have invented some component of modern healthcare, the number of companies that have grown in this city, it is astonishing how a city of this size could be that central to the way in which America operates, and yet it is. So there are a lot of people here. There's probably per capita more people with general knowledge about health in the Nashville area than any other metropolitan area in the United States. But that general knowledge, which is applied every day to run a company or to run a business or to run a hospital, doesn't necessarily translate into a community behavior. Because people have sort of switches in their brain. I'm now doing my job, so I'm going to apply these rules. I'm not doing my job, so I'm going to apply these rules. And they're not always the same rules. And people don't often bring them together. And here's what we think we've learned at the center. And you saw earlier the whole concept of blue zones. And the mayor and I were talking about the fact that if you combine his green initiative with blue zones, you get both of his campaign colors. And so we think this is sort of a signal that this could be really a powerful synergistic effort. We know to a remarkable degree what works. We know to a remarkable degree what enables people to live long lives, what enables them to live independent lives, what empowers them to be healthier, and we know that the secondary effect of that is that they earn more, contribute more, are more effective as citizens. So the fact is that you can put together this knowledge. In many ways, Healthways does it. The Gallup Healthways Project on a Wellbeing Index is a major step down the road of doing this. And yet what we don't know today is how to put it together so it works. And I just wanted to say, as a longtime observer of the federal government, this will not be done at a federal level. It's not possible. Our bureaucratic capabilities are too limited. Our ability to manage from Washington is too small. Our range of knowledge of local communities is too weak. And the fact is, what you've got to do is find ways for local communities to come together. That actually requires, I think, 3 steps. The first step is to create a value proposition that people can clearly understand, that enables them to say, yes, that would really be useful. And I think that in the work we've done and the work you've been hearing about today, it is possible to put together the concept of a healthier, more engaged, more productive, and less expensive Nashville that would in fact be a very powerful asset, whether you are recruiting new industry, whether you're helping local businesses be more competitive, whether you're simply improving the quality of life of your citizens. So if you could put that value proposition together in a pretty clear and coherent written form, but probably not much more than a page. The second question would have to, behind that page there might well be the equivalent of a book explaining how it could be done. But the actual value proposition is pretty straightforward. Would you like to be the community which optimizes independent living, optimizes good health, maximizes the likelihood that you will be able to spend your life productively, and minimizes the amount of time you spend with illness and the amount of time you spend in settings where you're out of control and somebody's having to take care of you? Now, if the value proposition makes some sense, I think putting together how that could be done is doable. But the second big decision is this something you'd really like to do, or is this kind of like New Year's resolutions? You know, yeah, it's a nice idea. I hope somebody does it. You know, I'll vote yes as long as I don't have to show up. Or is it that the government structures and the business leadership of the community, and candidly the news media, could be convinced that there's a community approach worth investing in, worth learning about, and worth making real? And that's really a decision about investing time and energy and the courage of leadership. Because to get that scale of change, you actually have to have leaders who say, you know, we're going to go in this direction. And then when people get confused, they say, let me repeat, we're going to go in this direction. And there are all sorts of interesting examples around the country. My favorite is Mick Cornett in Oklahoma City, who woke up in January of 2008 and decided that he had always been 30 to 40 pounds overweight, and he's the mayor of Oklahoma City, and he had never been able to lose weight. And so he announced on New Year's Day that there was a citywide weight loss project underway that was going to be on the computer. People could sign up for it, and he was the leader. And by September, when I was there as part of a Blue Cross Health Hero Dinner in which they honored Cornett as the leading health advocate in the state, the city had collectively lost 176,000 pounds. Every major restaurant had an additional set of recipes that were the Mayor Cornett recipes. People were routinely on Saturdays bicycling and walking. And there was now how permanent it is, how long it is, I'm not sure, but it's very significant. If you go to Finland, there is a province in Finland which historically had a very high level of heart disease. And 20 years ago, they undertook a fundamental dietary change. And the result was they had a radical decline in heart disease. And it was very conscious and very deliberate. And they set out, they had a conversation and said, dying early unnecessarily is just stupid. And so they set out to consciously change behavior to live longer. Fundamental difference. In Sioux Falls, South Dakota, they have a walking experience where they have mapped the entire town, much smaller than Nashville, but they've mapped the entire town so people who want to go out and walk, for example, can go from statue to statue, and once a year, all the school children of the city go and walk from statue to statue to every part of the town, just getting the experience. And again, it's a different pattern, it's a different way of thinking. And so part of what will happen as communities learn to think collectively about their health is different communities will come up with a different set of breakthroughs. I mean, the truth is you have the kind of climate here when you can have a range of outdoor activities that are significantly different than at my mother-in-law's place in western Wisconsin. Because she gets to a point about now in the year where if you're not into snowshoes, you're probably not going outdoors very much, which requires a different approach and a different attitude and a different setup. And so what I want to suggest to you is, one, that it would be very helpful both to have the folks who are actively engaged in health and the leaders of the Chamber of Commerce and the leaders of local government have a real conversation about, would you be prepared to undertake the kind of project which might make Nashville a genuine pioneer in creating the healthiest possible community and maximizing people's engagement in their own health, as a result of which you would have all sorts of secondary effects, from being a less expensive place to live, because you would literally have reduced the cost of health care, to being a more desirable place to live, because people are living longer and more independently, which then has an effect on your ability to attract new business and new job creation. Second, if you want to do that, whether it's through a health organization or through the chamber or however you'd organize it, you'd want to think about how could you structure an ongoing, continuing effort, because it does zero good in the long run to have everybody say, that would be great, I'm all for it, call me in a year. If it's going to happen, it will take people making a conscious decision, I'd like to be part of this happening, and then it requires, frankly, that governments as employers and corporations as employers decide to engage in the process of reshaping how they deal with health so that their employees and their families have an optimal approach to better health, better outcomes. And we can show you examples. That there is, for example, a very exciting project in Alaska among Native Americans where they have moved towards dramatically more management of chronic conditions. They moved towards much earlier intervention on things like teeth. I mean, it may seem like a small thing, but oral health is a significant predictor of other kinds of health. And so they've actually built a system where they've taken about 40% out of the cost of their health system, because they now have families engaged in optimizing their right behavior to minimize the requirement to be hospitalized. And it's a significantly different model of how to do things. And Healthways has all sorts of details in this. Gallup has a lot of material that with Healthways they've developed in what is the largest database in the world now on health information. So we think that's possible. At the Center for Health Transformation, we're actively looking for 3 to 5 communities that could become pioneers from which the rest of the country could learn how to do it. And we think it's actually done at a metropolitan area level. I think you might be able to try to do it in a state as small as Rhode Island, but I think as a general rule, states are too big because people don't see each other every day. And to get this kind of change, it's got to be pretty easy to get together for breakfast, talk it through, monitor it, share ideas, learn lessons, and to build a community spirit, which I understand went up substantially yesterday afternoon. The well-being index for this particular area jumped dramatically between yesterday morning and this morning. So let me. I'll be glad to answer questions in general, but I really want to just lay that notion on the table. Let me just suggest to you, if you look on the planning and leadership model, all I'm suggesting is that if you laid out the values you want to achieve, what is it people here really value in terms of health, well-being, living independent lives? If you turn that into a vision of the Nashville area, And you then set metrics. How would you measure it every quarter? And again, with all the work that Gallup and Healthways are doing in the Wellbeing Index, they can literally measure by metropolitan area. Then once those three are done, you can start developing strategies to achieve them. You know, do you want people to be more active? Okay, what are your strategies to do that, and how would you know if it was happening? Do you want people to lose weight? How would you do that? Do you want people to have earlier testing? Do you want people with chronic conditions to manage themselves better? And there are a variety of things being done, and what we see is around the country, there are hundreds of little projects that are getting single improvements, but to the best of my knowledge, there's no integrated community anywhere that is getting those improvements to work with each other to build a synergistic effect. And finally, how would you launch projects to achieve this? Now, and then what do you do every day as a task? That's a model of thinking and planning which you could do by yourself, you could do with a handful of people. But to actually get the job done, you've got to come over here to this leadership model, which means you'd have to listen to the community. I watched, for example, Carter's Atlanta project not penetrate very deeply because it was always on the leadership side where they told everybody else what they thought, and there was remarkably little listening. I mean, you have to start with the people of the Nashville area. What do they value? What do they want? What is it that inhibits them from the breakthroughs? Why has it been hard to get there? And if you genuinely listen to people and learn from them, they'll almost always think you've helped them because they ventilate, they get it off their chest, they get it out in the open. And because you have ideas, you have information, you have resources, if they think you've helped them, they'll almost always ask you to lead. And when you ask them to lead, you say, well, these are my values, and this is my vision. These are the metrics we're going to use to measure it. These are our strategies for implementation. We think that means we need these projects, which means we need to do these tasks every day. But notice what you then do. You come back over and you say to everybody, what do you think? And so every single person becomes a consultant. Everybody becomes an advisor. We live in an age where between cell phones, BlackBerries, laptops, I mean, even for very poor people, cell phone penetration is immense. And nobody's ever tried to design a cell phone mediated community-wide health system. But it's doable. And you suddenly have a totally different rhythm of people sharing, talking, solving, doing things together as a community. And in part, I think it can help rebuild the whole sense of community. You'll notice at the very bottom on this page, we believe health starts with individual rights, responsibilities, and expectation of behavior, and then moves to the society. And you don't actually get to the health care system until the third box. You don't get to financing, which Washington is fascinated with, to the fourth box, which is why we think Washington is mostly somewhere between destructive and irrelevant in trying to develop the health system of the future, because they're focused on the wrong end. But this means, I'll just give you two quick examples. This would mean if you want people to maximize their health, one of the things you know you want them to do is walk, which means one of the things I recommend strongly is K through 12 physical education, 5 days a week. And one of the radical things I suggest is if they live within a mile of school, have them walk to school. And in fact, all the things we've done over the last 25 years to build bigger and bigger bus services and to have parents drop the kids off, all of them are contributors to bad health. Now, I realize I'm going to meddling, but on the very back, we have a series of key sayings, the first of which is Einstein, doing more of what you're already doing and expecting a different result is a sign of insanity. I just want to suggest all too often you have people come in and say, yep, I sure want a different outcome, and I'm ready tomorrow morning to do exactly what I've always been doing. So part of what you'd have to ask yourself is a healthy Nashville and an empowered Nashville with lower costs, longer lives, and more independence actually worth change, actually worth investing in, and something you're prepared to actually establish metrics and say, we're going to work at it till we get there. Because it won't happen overnight, it won't happen quickly, but the potential for it to happen is enormous. We have seen these revolutions before. We have seen enormous breakthroughs in the quality of public health. And if you went back to 1800 and you looked at the waves of fundamental change that have enabled us to live longer, remember, as late as 1900, the average person lived to 46 years of age. We've had enormous improvements. And now the question is, can we have another wave of improvement that will actually make almost all of us more engaged, healthier, and more capable of being productive, and enable us to live not just longer physically, but enable us to live independently and productively and with lives that are really exciting for much longer periods. I think the potential's there, but I think it requires real change in the system we've been in. I don't want to take too much time because I really want to listen to the governor, but let me, if I might, toss it open for questions just for a couple minutes. What would it take to change the policy to say walk to school? I suspect that that's a school board decision, but I don't know the structure of local authority, but my guess is that the school board could do that. Now, you'd immediately have a fight over the school bus drivers. You'd have a fight over parents who are worried. You'd have to, part of this sometimes is readopting old things. Like some of you, or a few of you, I won't say many, a few of you are old enough to remember when you had crossing guards. So instead of paying people to drive the bus, you paid people in the afternoon for an hour to stand by the crossing. And there were a lot of things. I mean, societies used to do lots of things to enable people to actually walk to school. Now, again, I don't want to seem like I'm too radical, but I'm prepared to reinvent raincoats, boots. I mean, there are a variety of things that we used to do that actually worked. It's not always about inventing the future. Sometimes it's about rediscovering the past. The only thing I recommend to you for today, and I'm in no way, I don't want to get this to in any way be partisan. The only thing I could recommend to you today is, if you get a chance, read the Wall Street Journal's lead editorial, which suggests that the bill introduced in the House last week may be the worst bill in modern times. And it walks you through, for an entire 2 columns, all the different things that are wrong with the bill. I think if you check with your local hospitals, without putting the governor on the spot, if you check with virtually any governor in the country, in this economy, with the states collectively facing $142 billion in deficit in 2010, the idea of an additional unfunded mandate is irrational. If you check with the hospitals, the idea of a dramatic increase in Medicaid, which will underpay the actual cost, will literally bankrupt the system. You're just going to see lots of hospitals go bankrupt. I mean, and we've had several members of our center who are very big hospital systems who have run the numbers and told us that if it actually passes, you should expect a substantial number of bankruptcies over the next 3 to 5 years. Because all they're doing is they're saying, we're doing this, we're going to balance the federal budget because we're not going to pay for it. So we'll mandate it, the governors will pick up the Medicaid part, and the hospitals will have to cost shift the other part, which means private sector insurance will go up for everybody. One of the things we never did, in California, Medicaid, Medi-Cal, as it's called out there, pays 38% of the cost of the service. So every citizen in California pays taxes to pay the 38%, and then they pay a hidden tax on extra charges for their private insurance to cost shift to pay the other 62%. And I've tried for years to get hospitals to actually post that on to say, this is the amount we're charging you for what you got, and this is the amount we're charging you to cost shift. And I think you'd see people rapidly begin to figure out what the current game is. It's a very big problem. We think that it can be fixed. The Center for Health Transformation was founded for the purpose of thinking through fundamental health reform. And we believe in fundamental health reform. But we're also, frankly, fans of the governor and believe that the work he has done and the time and intensity he's put into rethinking health in a very difficult environment in Tennessee is a real model for the country of leadership. And I wish more people in Washington were listening to what he's learned and what he's had to live through, rather than just sort of charging merrily down the road, inventing a fantasy. That's actually a great question. I'm going to use it to sort of describe an enormous change, and then I'm going to turn it over to the governor and give him a chance to comment on the whole system. But I want to use it to take you to the area of American health which has been the most successful at fundamental change, and it's your teeth. Now, I don't want to embarrass you, so I'm not going to ask how many of you failed to brush your teeth this morning. But the odds are pretty good that somewhere between 95 and 98% of the people in this room brushed their teeth this morning. Now, you may never have thought about it, but that's a learned habit. I mean, humans are not born brushing their teeth. And parents, grandparents, teachers, dental assistants, the amount of reminder you get to brush your teeth. Many of you probably know you should brush up and down. And so dentists, and this was not true, I talked earlier about great changes. 150 years ago, very few people brushed their teeth. And the invention of the modern toothbrush and the invention of modern toothpaste, which was originally tooth powder, were great commercial breakthroughs. People forget how much of modern health is in fact commercial. And people like Colgate, Palmolive, came out, Crest, and they gradually developed this. Then the dentist did something that was one of the great case studies in professional rather than commercial behavior. They wanted to fluoridate water to minimize cavities. Very controversial, big fights in the 30s, 40s, and 50s. Substantial number of people who believed fluoridation was communist. And gradually the dentist won. Now think about it. They were consciously eliminating a major source of their income because they were going to reduce the number of cavities. And they promptly invented braces. And they said, I don't know how many of you remember this, but my two daughters couldn't get their 7th grade picture unless they had braces. It didn't matter if they had needed braces. They had to have braces socially in order to be in the 7th grade picture. Okay? So now we have the baby boomers getting older, and they start moving from, you've already had your braces or you're hopeless, and so they now move towards flossing. How many of you have had the lecture on flossing when you go to get your teeth, right? Now think of this. You go to get your teeth cleaned. In the 19th century, you never went to the dentist until the pain was so great that the only thing they were going to do is pull your tooth. Now you go and schedule to get your teeth cleaned, right? And you're there. I'm now old enough, and it turns out, by the way, that taking care of your gums matters because the germs that infect your gums are exactly the same as a major form of heart disease, and therefore having a healthy mouth is useful in having a healthy heart. Now I find all this just bizarre, frankly. I'm a historian. What am I? So now they've got you. I personally use the kind of little flossers. I don't like the one we have to do this. So I have a little flosser I use every single morning. And when I first started doing it, I was getting browbeaten by the dental assistant because I wasn't doing it often enough. And now, being a good student, I'm proud to tell you I get an A for my gums, and I'm really proud of that. Okay, so I'm doing all right. And one afternoon, I'm driving home, and I'm listening to Sean Hannity. And he is describing some goofy thing called Bright Smile, where you get to go and sit in a chair for an hour, and your teeth get really bright and white. And I walk in the house, and I said to Callista, you should hear the really dumb thing Hannity was advertising. And she said, guess what I had done today? Now, I want to let all of you know that I found personally Bright Smile was a very effective technique. There's nothing wrong with it. So you've gone in about 120 years from dentists were barbers who only pulled teeth through very low-speed, painful drills that were very painful and noisy, to very high-speed drills, to fluoridated avoidance of cavities, to having to have braces, to taking care of your gums, to Bright Smile. Now, in a sense, what we want to do is take cardiovascular conditions, diabetes, arthritis, move them through similar patterns of externalizing it so it becomes a routine habit that only happens if a community decides to do it. And in my judgment as a historian, that will only happen if a handful of communities decide they will do it, they pioneer how to do it, and everybody else then copies them. And that's why I thought this particular event in Nashville was potentially truly historic, and why I was so grateful to be allowed to come and spend time with you. Thank you very, very much.
As usual, Speaker Gingrich, provocative, interesting, on target, candid, and very helpful to these discussions. I'm Tom Cigaran. I'm the chairman of Healthways, and it's my pleasure this afternoon, I guess it is, to introduce the 48th governor of the state of Tennessee, Phil Bredesen. Phil was elected in 2003 and re-elected in November of 2006, I guess it was, by a landslide. And in Tennessee, He won every county in the state. And you know, there's some states where they have 5 counties, and some states they have 10 counties. Well, we've got, I think, 95 counties. That's like getting 95 people to agree to anything. So he has been, by all measures, an outstanding and exceptional governor. Some of his contributions, and they're varied and numerous, but are in economic development, public education, conservation, and then, as Speaker Gingrich said, in rationalizing a totally dysfunctional Medicaid TennCare system, which actually ended up incorporating more people into insurance coverage, but at a cost that was sustainable. Before his reforms, the state was going to go bankrupt just on TennCare expenditures. He's had a long-standing commitment to well-being. He pushed through the legislature in 2007 a ban on smoking in public places. And that, as you all know, will have a significant impact on well-being long-term. And we like to offer our governor a special thanks because he arrived from 2 weeks in China and Japan late Friday night, 13-hour time difference, jet-lagged, and still agreed to be with us here today. So please join me in welcoming our governor, Phil Bredesen.
Thank you, Tom, very much. And I'm still a little bit jet lagged, so if I could have just one coupon buy for some single stupid thing that I say here that I can get a buy on because of that, I would appreciate it. Tom, thank you for the very kind introduction, and I certainly want to begin by thanking all the people who worked to put this together, which includes the Nashville Health Care Council, the Nashville Area Chamber of Commerce, the Center for Health Transformation, and a special word of thanks to Speaker Gingrich for being here. Thank you so much. I suspect he does not remember, but I'm positive he doesn't remember, but the first time that I ever met him was in the mid-1980s when I went to Georgia to open a health center for the company I was running. There were about 12 people there for the ribbon cutting, and one of them was the congressman from that district in the Atlanta area, and he wanted to talk about health care. And that conversation has continued over the years. I also want to acknowledge Mayor Dean. It's great being with you again. Vice Mayor Neighbors. I have a number of my commissioners who are here, and probably the most interested in all this stuff, Darren Gordon, who runs TennCare. I saw when I came in, and Darren, I'm glad you could be here as well. Before I start with just a few things that I wanted to say here today, I'd like to respond to something that Speaker Gingrich said in talking about health reform in the states and the impact on the states. And you were very kind to say, I don't want to put the governor in a box. Let me be very clear about where we are on this. We have an enormous problem facing us with what is going on right now with health reform in Washington in the narrow sense of the state's financial viability. Here's the situation. We have had some real revenue problems, as everyone knows, and it's not unique to Tennessee. It's virtually every state that is out there. In 2014, we expect to be back to the same tax revenues that we had in 2008. In 2014, we expect to be back to that level. At that point, we will have given state employees no raises for 5 years. We will have drawn down our state reserve substantially. Remember, states don't borrow for operating. We have to save in advance. Our pension fund will be very frayed around the edges because of what have happened in the markets. We will have made no major investments in new initiatives for 5 or 6 years. No major construction on campuses, no major new initiatives in the state. And just so there's an enormous hole at that point to dig out of. Just at that point, along comes a substantial additional bill in our Medicaid program. And it's real. We're guessing over the 5-year period from 2014 to 2019, with the Senate bill, it's $750 million. With what's going on in the House, we're still putting figures on it, but it's over $1 billion. These are real, substantive challenges to the financial viability of our state. And I've spent an awful lot of time with other governors trying to sort of put some rationality and some sense into this. It is vitally important that we do so. The states are not in a position to absorb these costs. Now let me go on and talk about what I wanted here today, and I really want to mention a couple of things. Number one, I want to celebrate for a moment some of the work that is being done and was talked about this morning, and then we offer a caution or two, or maybe just some things to think about as we go down this road. First of all, I want to say how important I think this meeting is, and to Ben Liedl, he and I have had a chance to talk on several occasions about this. I think what you're doing, I think particularly this well-being index, the Gallup Healthways Index, is going to be a terrific contribution to the health of our community, and through that to the health of individuals, and I certainly celebrate and admire what it is you've done. To put it in context, the reason that this discussion is important now, just as it in another way was a century ago, and another way it'll be a century from now, is that the world is changing very rapidly. We're all sitting in bodies, and we have minds that have evolved over a long period of time for a very different world than the one that we live in today. I remember thinking, a world of much smaller societies, of very different food, very different lifestyles in terms of physical exercise and the attributes. Ben gave me that book, Blue Zones. The author is sitting down here, which I read somewhere over the Pacific on my way over to China. And I had a couple of thoughts about it. Number one, when I read about those blue zones where people were living a long time, it's hard to think how you get much further from those than sitting in a 747 over the Atlantic eating airline food quietly in your seat. But second of all, and more pertinent, in a way, the common element, for those of you who read it, to all of those little societies that were so healthy is that they were living much closer to the way that we have evolved to live over the years. Their lifestyles, their social structures, their food patterns were much more like the things that our DNA programs us to work well with. Now, we live in a world where that's all changing, and it's not, these changes are not going to go away. I mean, cities are not going to go away, and the anonymity and huge lack of social structures is not going to go away. The social and geographic mobility we have, which breaks up family structures and so on, it's not going to go away. It's interesting. I grew up in a small town with my grandmother who had 11 children, 10 surviving into adulthood. In the town that I grew up in, which is 1,100 people, all 10 of those children lived and raised their families in that town. I mean, I am the product of a very integrated, close-knit family in that way. The next generation down, the next generation below, they are all over the world, literally. There's none of that left, and that's something that's happening in the last half a century throughout this country. The foods that we eat and love, we're not going to stop liking sugar, we're not going to stop liking hamburgers and all those things. We need to be thinking about how we take these bodies we have and these minds that we have and make them work in these new elements of society. And that's what I think this is ultimately all about. How do you marry those two things that were going on? How do you create communities that work in the light of the kind of realities of the world as we have here today? Now, as governor, I mean, I've worked on a whole bunch of things that are in the order of trying to promote healthy behaviors. I mean, started out, if you remember, Andrea started out doing her Andrea walks across the state and got who knows how many people who had never walked more than 400 yards in the last several years out there for miles with her for days at a time across the state of Tennessee. We have Get Fit TN that we're working hard on. Our health department has any number of programs to help people deal with some of these lifestyle issues. Our education department, our commissioner is down here, is working hard on trying to instill healthy behaviors in the schools, particularly with regard to eating habits. The mayor has a livability project in town. And in a way, many of the things you do in government are really about creating healthy communities. I mean, we've got a Tennessee Bureau of Investigation and a Highway Patrol and a Corrections Department, which is really at its core about how do you create safe communities in which people can prosper and live. How we bring these things together is going to take a long time to answer. It's not going to happen in one day, but this discussion is really important. I want to talk for a second about personal responsibility to kind of segue into what I read, the narrow thing I wanted to say here today. You know, there's this old joke I remember about how the world is divided into two kinds of people. There are those who think the world is divided into two kinds of people, and those who don't. I think in a way that I think the experience of most people is that one of the divisions in this world is that there are people, you all know, who just ultimately accept responsibility for their lives and who they are. Sometimes they fail at it, sometimes they succeed at it, but they accept that responsibility. And there's a lot of other people to whom things just happen. Whatever happens in the world is somehow the fault of something else. When it comes to health and well-being, that first way is really the only way to go. There is no way that the federal government or the state government or local government by itself is going to be able to deal with these issues. Now, the thing I want to talk about in cautions or something to think about a little bit is, as I've listened to speakers on this, as I listened here, I think we need to really be careful and think carefully about the domains in which we're trying to do this. And by this I mean is, we have a world of medical care. We have health insurance, we have doctors, we have hospitals. It's responsible for a piece of this entire equation. There's the world of public health, which is both the formal things that we do in a public health department and the more informal things that are led by government, like the speaker was talking about, something that the mayor might do here in Nashville. And then there's the whole third area, just personal choice and responsibility. And very often we let these things, we're not careful about letting these things not slop over into each other. We all know that these lifestyle issues are huge. They are a dominant part of the health of our populations, a dominant cause of both unhappiness and tragedy and cost in our society. But think about something in that smoking. It's a really hard question for me anyway to think about. Where exactly does what responsibilities lie where to deal with that? If you are a person with insurance and you go to the doctor, what are the kinds of things that are guaranteed to you? Well, treatment for cancer, your lung cancer you get from smoking, that nobody questions that. That's guaranteed. You should certainly have that. If you want to quit smoking, the anti-smoking drugs are increasingly a part of that equation, and this health reform bill has got further provisions to making those in there. You're probably entitled to advice from your doctor. How far beyond that, though, does the responsibility of the medical system itself go? What else is your doctor and his nurses responsible? Or what are those things that are in the domain of public health that ought to be in the form of education, that ought to be in the form of initiatives at the local and state at the state levels, and what are the things that are personal responsibilities? Put it another way, I don't smoke, I don't incur any of the costs that go with that. How much of my money should you take to persuade somebody else to that they shouldn't adopt a behavior which is damaging to them? You have the same issues in a host of other areas. When it comes to obesity, it's the same kind of thing. What's medical care? What's public health and education? What is just personal responsibility? We just returned from China. There's a number of people in this room that was over there with me. One of the interesting facts I found out over there talking to some healthcare officials is that China, in its big cities, they listed their number one concern in the health was they were starting to get a lot of fat people in the cities. that it was starting to happen in China as well, the same thing that has happened here, same thing has happened in the European Union. This is a universal problem. It's got nothing to do with the form of your health insurance or how your health care is organized nationally. When you come to some things like diseases, diabetes, where does the responsibility of the doctor lie? It certainly should prescribe you your blood pressure medication that's really important to take. If you don't take it, how far does the doctor have to go to ensure that? What are the responsibilities beyond that? What are the responsibilities beyond that to pay for? So I guess what I'd like people to do as you think through this stuff is to kind of keep separate in your minds what are those things that really are part of a medical care system to which everyone is going to be guaranteed access, and what are the parts that really are a broader responsibility of government, what are the parts that are really in the realm of personal responsibility. One thing it's important to remember during all of this discussion about health reform, the health reform that we're talking about now is almost entirely, not 100%, it is almost entirely about extension of health insurance to additional people. That's where all the money is, that's where all the discussion is. And yet, the world is full, Nashville is full of examples where that's not going to change any of these metrics at all. I give you an example. We have a significant problem in Tennessee. We've got a significant problem right here in Nashville with low birth weight babies. If you go to one of the poorer areas of Nashville, you will have low birth weight baby ratios that you have to go to a deep into third world country list to get to the same kinds of ratios. And yet, virtually every one of those mothers has very comprehensive health insurance. They're almost entirely people who belong to TennCare. Whatever is happening there, it's not being solved by access to the financial access to the medical system, and we need to. We need to deal with those issues in a different way. We very often drive the responses to these things upward to the medical care system. And one of the things that I like about this discussion today is it has been much more about what communities can do, what individuals can do. But this driving into the medical care system happens for a couple of reasons. Number one, there's a long history of doing that in this country, starting with probably in the 50s and 60s. Lots of problems that would have been societal problems prior to that became medical problems. Substance abuse, for example. In 1945, that was a personal failing. By 1960, it was a medical problem that should be solved by the medical community. We've been doing that for a long time. Second of all, and probably even more important, in our system, that's where the money is. If you can get something into the medical domain where it's covered by insurance, whether it be government insurance or private insurance, that gives you an open checkbook and it drives the behavior enormously. Think for a second about an industry which has successfully done that with all of its products, which is the pharmaceutical industry. You have an industry that can invent all sorts of drugs that may or may not have anything to do with basic health, and get it into the medical domain and get it paid for. When I sit down to watch TV at night, I'm sure I will find at least one ad for Lunesta, which is a sleeping pill. And you know, the young woman wakes up and stretches in the morning and she had a wonderful night's sleep because she took her Lunesta. Well, Lunesta is $6 a pill to go out and buy it. And the question in my mind is, why should a medical care system be taking responsibility for these kinds of things, which are much more in the area of lifestyle? More particularly, why in something like TennCare, it makes no sense at all to me for me to have to pay for all of the Lunesta that somebody wants and can be prescribed in favor of or over putting money into stop smoking programs or eating programs in the school system. It's because we've gotten that stuff into the medical care system with the kind of open checkbook that our system represents. If it's not in that system, it's got to compete with every other priority which is out there. Our health department in the state of Tennessee is going to have its budget hearing this month, and it's going to be up against mental health and corrections and the highway patrol and everything else in the world competing for its dollars. Medicaid won't be doing that, and the state health program won't be doing that. It gets its money off the top in the system that we have. Once in a while, I have some young entrepreneur who will, in the healthcare field, who will want to come and talk to me about, is this a good idea to get ahead? And I'm sort of ashamed to say it, but one of the first things I always tell them is, look, the basic division about ideas in healthcare is either you can get it paid by insurance or you can't. If you can get it paid for by insurance or by an insurance company, that's a pretty good road to go down. If you can't, you're just one of a million businesses getting started up out there in the world, and it's going to be a tough road. I guess in concluding, I just want to say, as we think through these lifestyle issues and how we improve the health of our populations, I think we have to be very careful to think carefully about what the edges are between the medical care system, the public health system, and individual responsibility, and kind of explicitly think about those kinds of things. If I had the choice today, I'm a governor running a government, if I had the choice to do what I wanted, I would dramatically decrease the amount of money we spend on Medicaid and dramatically increase the amount of money we put into the public health system in our state. We would get better results if we did something like that. The financing of healthcare has really skewed the way in which we look at it, and the health reform which is underway today does not touch that in any way. Let me conclude by saying, first of all, congratulations on coming together like this and raising this issue. I've heard at some length from Ben about the database work that they're doing. I think that stuff is extraordinarily valuable. If we could all come back together in this room 100 years from now, I think people will look back at things like the development of those huge kinds of longitudinal databases to be one of the key elements in the kinds of progress we will have made in improving the life and the health and the well-being of America's citizens. Thank you very much.
This has been a presentation of the Nashville Health Care Council and Nashville Public Television.